Good morning, everyone. How's everyone doing? It's not Monday, it's Thursday, we're almost there. Welcome to the Sexual Violence Prevention Network, known as SVPN. I'm Amy Kenzie, and I'm the Sexual Violence Prevention Program Director at the Minnesota Department of Health. And I coordinate these SVPN meetings, and also I have lots of co-planners. My Sexual Violence Prevention Program evaluator colleagues, Marissa Gay, who's an evaluator and also running our camera for us today. Thanks, Marissa. And also Melissa Kwan is one of our Sexual Violence Prevention Program evaluators. So you'll be hearing from them in a little bit. And you met also on our team Doug Palmer, who's tending to the coffee in the back of the room and registration. Is it ready, Doug? Okay, thanks, Doug. Ready to go. Okay, great, thank you. And also our co-planners, we co-plan with MINCASA, the Minnesota Coalition Against Sexual Assault, and co-planners with two folks over there, Hannah Laniato, who's on maternity leave right now, but also Adri Perez. Wave, give a wave. Adri's pretty new. How long have you been with MINCASA? 2.5, 3 months. 3 months. So Adri is new, and we're happy to have her with us in our in planning these events. So I just want to do a few announcements. One is to please mute your cell phones. You can tell I'm going to have a really good day here. Also, I'd like to ask all of you that during the presentation, if you would please raise your hands. I know it's a small room. We think we can hear everybody, but we want to be able to get a mic to you so that you can ask your question in the mic so it's picked up by our recording. As you can see, Marissa is recording this event. And our recordings of these meetings are posted on our website about a week or so after our SVPN meetings, and we'll send out an announcement when those are ready. So I just want to get a quick sense of who's in the room. Could we, are there any advocates in the room? Probably some advocates, usually are. Great, thank you. How about educators? Educators, great. Any state agencies? Tasha, I saw that hand. I did not see, there's John's hand. Okay, okay. Any other state agencies? DHS? Okay. How about researchers? Great, great. Epidemiologists? See, I'm just trying to get you to raise your hand a lot, John. How about healthcare? Any healthcare? Okay. Mental health? Okay. Who have I missed? I kind of ran out of folks on my list here. Where are you from? Students. Great. Thank you. And also, if anyone in the room chooses to identify as such, are there survivors in the room? Okay. Anybody else? Who did I miss here? Service providers, okay. Anything else? Got everything covered? Okay, great. How about preventionists in the room? Yep, okay, there we go. Now we're covered. John, you raised your hand for that, thank you. I think this is going to be a pick on John meeting. Actually, I did miss one. Faith community, any faith community or folks representing faith community? Okay, thanks. All right, well, the purpose of our SVPN meetings is to present a sexual violence topic. We have been doing these meetings for many years, so we like to present topics on sexual violence and with the frame of prevention, so that we're coming to these meetings thinking about what can we do to stop this before it occurs, stop the harm before it occurs. Our other purpose of these meetings also is to network, so I hope during the break you all will turn to your neighbors and introduce yourselves and get to know each other, and also to share resources. There are some resources at the back table, and I have to admit we were cleaning cabinets and a lot of them are old, but I think they still have value in their shelves. shelf life. So please take a look at those and take as many as you want, because I'm not taking any of them back with me. We still have plenty back in the office as well. So again, our frame is prevention. So I want to just spend a few minutes before our speaker comes up and talk a little bit about prevention. And for those of you who attended our human trafficking task force last week, I just want you to know I will not be talking about the prevention of dog bites. Was anyone at the task force meeting? Okay, see, you won't have to hear that again. I've got a whole new thing to prevent here. So the reason I'm doing that, I want us to think outside of the box and not be thinking about sexual violence prevention. Just think about prevention in our daily lives. So we all do things in our daily lives to prevent harm and to prevent injury and health issues. So we brush our teeth every day, right? Hopefully everybody brushes their teeth. You do that to prevent tooth decay, also to have fresh breath and to be able to network. We try to eat healthy foods to prevent obesity and cancer. We try to exercise to prevent heart disease and other illnesses. We put our children in car seats. We don't text while we're driving. So are there any other things you do every day to prevent harm from occurring? Any thoughts? What do you do every day to prevent harm or injury? Awesome. Wear your seatbelt, okay? Lock your doors. Any others? What about for kids? Anyone with kids? What do you do to prevent injury for your children? Bike helmets, thank you. And adults should wear those bike helmets as well. Yeah, model that good behavior. Anything else?
Talk to them.
Talk to your children.
Engage them.
Excellent, thank you. Thank you, awesome. Okay, so we all do things every day, and many of the things I mentioned are likely the result of maybe education and campaigns that we've heard. Texting, we've all heard campaigns about not texting while you're driving or using cell phones while you're driving. So the thing about, so education is huge. We have to have education, but what has broad impact are policies and at an organizational level and at a state and local level. It's those policies that have much broader impact, and we need that along with this education piece. So, and also about that, also with organizational change and policy change, those are the kinds of things that can change these social norms. We know, I mean, I can't imagine anyone getting in a car anymore and not putting on their seatbelt. I think they do, but I think most of us know that that's a pretty normal thing to do now, is put on our seatbelts. Although I do remember, as a kid, we never wore seatbelts, so I had to train myself. So another good example of this is the anti-smoking campaign. For years, there was education around quitting smoking. There were smoking cessation programs, but it really wasn't until we had sweeping policy changes where we now have smoking is just not permitted in public places. So, as you can tell, I'm sort of trying to push this policy piece, this organizational practice and policy piece, and we'll have more on that with our prevention activity coming up. But I do want to talk just a little bit more about this as soon as I can figure out. Okay, I did it. See, she's coming over here because she doesn't think I can handle this, and I know I can. Save that. See, I'm going to get it. Oops. I have to prove myself here. That's not it. Okay, I need your help. No, wait. It moved up here. See, I had to prove myself. I can do it. I can do it. I can prevent. Oh, what's that?
Just the screen is up.
Okay. There we go. I guess I do need a mic. Okay, so, and this isn't on. Yes, it is. All right, So I'm going to push this even further because I want us to not think about sexual violence. I want us to think about other kinds of prevention that we can do. And Melissa is going to type in some of these examples. So our first one, we talked about eating healthy foods. So as we think about these healthy behaviors that can occur, so on an organizational practice level, one of the things we can do to encourage eating healthy foods and eating fruits and vegetables is perhaps providing easy access to vegetables and fruits at work. And actually, Melissa suggested a fruit cart, which I think is a great idea. I don't know who's going to pay for that fruit cart, but I think it's a great idea. On a policy level, we can work to ensure that all school lunches have vegetables included. And we've done this, this has happened for many years now. And this is all about encouraging healthy eating starting at a very young age. So for exercise, if we want to encourage people to exercise more, what could we do at within our organizations where we work? What can we do to change practices to get people to exercise more? Any thoughts on that? Incentives, awesome. Okay. Like walking, talking meetings? Awesome. Gyms within your organizations. Great. John?
To help subsidize bus passes so that people don't drive to work every day, but take the bus. Almost always walking and busing involves more physical activity than driving a car. And it was really heightened to me when I found out yesterday that the State Department of Health is reducing its subsidy on bus passes, which was argued against by our division director. But that's a very important organizational piece that someone can do to help encourage physical activity.
And that was so good, and I can't repeat all of that. Adri, would you, so I think this is important, John, so could you repeat that into a microphone? It may have gotten picked up on the recording, but I want to make sure it is, because that's such an excellent example.
Yeah, so one of the things that organizations can do to increase or to help support physical activity is to subsidize bus passes. And that was really because almost car driving involves the least amount of physical activity. Taking the bus to work, walking, biking, all of those things involve much more physical activity than driving your own car to work. And this was really brought to my attention yesterday when I was at a managers meeting that highlighted that the Minnesota Department of Health is reducing its subsidy for bus passes. And this was objected to by our division director, Mary Manning, who said this is counter to the values of the health department to reduce the subsidy. Nonetheless, there is a shortage in the executive office, and perhaps different parts of the health department don't value organizational practice encouraging physical activity and reduce carbon emissions, et cetera, as much as our division does. But anyway, that I became acutely aware of that as of yesterday.
Thank you. Thank you. And I'd like to get that fruit cart too, by the way, if we can't have that. But yeah, that's so important, and it takes a lot of work. And there's pushback, and we have to keep pushing for these kinds of things. So let's move on to policy and legislation around exercise. Anybody have thoughts on what we can do legislatively, either locally or at the state level, on what we can do to encourage exercise?
Implement more bike paths and walking paths.
Bike paths, walking paths, thank you. Anything else?
Implement incentives. If you use a gym 12 times a month, we'll give you $20 off your health insurance or $20 off your gym membership.
Excellent, excellent, thank you. Okay, how about car seats? How do we make sure that children are in car seats? What could we do at an organizational practice policy level? Or what's already happening at that level? John?
Hospitals don't let babies go home unless they are in a car seat.
Exactly. That was my my written down prompt, but that's excellent. Anything else? Providing car seats. And I think some hospitals do provide car seats when they leave, even if it's a loaner. Yeah, I know there are. Is that a state law, John, or is it a hospital? I don't know. Okay. How about local laws or state laws? Anyone have thoughts? Okay, I have one. How about that it's illegal to have your infant in a car and not in a car seat? Anything else? John?
Yeah, so I think about all these kinds of things. But we could remove sales tax on car seats and make it just say, we're going to just be a kind of a symbolic or just a small support. But we could say, this is so important to our society that we will not charge sales tax on car seats.
Excellent. Thank you. Tasha? Is that the same thing? Okay.
I was just going to say we often don't think about enforcement. I don't know if either you count that in policy of legislation, but we already have laws that require car seats, but I'm not sure how well they're being enforced or whether we have some creative ways to think about enforcement.
Excellent point. Thank you, policy person from Humphrey. Okay. Texting and driving. Anything on that? How do we make sure people are not texting while they're driving? Oh.
Well, at my organization, it's actually a written policy in our employee manual, and we've periodically send email to all staff reminding them that this is in our policy, as well as it being a state statute.
Excellent. Yeah, as a state employee, we are not allowed to even use our cell phones, I don't think, when we drive, and no alcohol, no smoking, no cell phones. Any others? Okay, how about at the state level, state or local level? Law changes. I'm just wondering, John, is it against the law? What is the law on texting? Okay. Okay. Can you use a cell phone when you're driving? Okay. Okay.
Commercial drivers can only use the one push cell phone use. They can't dial, but they can push a single button to answer or whatever. So there are some additional requirements there.
Okay.
I just want to say on that organizational practice.
Let's use the mic then. Yep.
On the organizational practice, I just wanted to say yesterday I was working on a position description for a new epidemiologist, and part of that position description, as was put in by my boss, is that it's required that you do not engage in distracted driving, including texting while driving. That's part of the position description, and then that becomes part of our annual performance review.
And it changes the culture in our workplace. We see more of that in our position descriptions, and it becomes the norm. The norm is we won't do that any longer. Any others? I saw a couple hands.
I was just going to say that my parents live in Texas, and they recently passed a law that you cannot use a phone to talk or text at all. You will get ticketed. So that is something that I'm sure Minnesota will look into. It has to be hands-free only.
Great.
And I know my daughter's new car that she bought, if anyone texts her, like I will text her, I will get an automatic reply saying, this person is driving, cannot receive your text, and cannot text.
Actually, I just upgraded my cell phone, and it gave me that option. I'll have to say yes to that. Another one up here.
Just a clarification as far as, aren't there much more specific rules in regard to teenagers and texting and license process? I'm far from being a teenager, and I don't have a teenager at home, so I'm not really sure of what that might be. But I thought I heard something in regard to that, or maybe that's where the laws regarding texting came out of, were teenage.
And I'm not certain on that, but I just have this feeling that John might have some information on that. I don't know what gave me that inkling. So we're public health here, you know. We've got
this is our
some
life,
things to say.
Yeah, we live this. So, yeah, kids cannot even use a cell phone while they're driving. They are just to be, and similarly, it's not a drop for alcohol. You know, they can't be at any detectable level of alcohol. They cannot use a cell phone at all while they're driving. So yes, we do have, that's part of the graduated driver's license strategy.
Great. Well, thank you. See how we all do prevention every day. And so often we think, oops. Oh, great.
Anyone who applies for federal grant money, if you actually read those conditions, you'll see that don't give money to Acorn, don't set up a computer to distribute porn, and don't text and drive. Sorry, can you hold that? Oh, sorry. It's a part of a condition for if you get federal grant money. I don't know when they added in there, but anytime you're doing any work related to a grant, they tell you not to text and drive. There's another.
Great. So you can see the huge impact policy makes, and whether it's at your organization or whether it's local or statewide laws. Again, this education piece is hugely important. It takes, actually, we do want to switch to the next slide. This leads us right into the spectrum of prevention. And we need all these levels of the spectrum. We need to do this education piece, but what we really need in order to have broad impact are these top two levels of the spectrum of prevention. And so we'll be talking a little bit more about that later in the meeting. Actually, you all have a handout on that that includes the spectrum. And there was a point I was going to make, but I'm going to skip it. I'm going to save it for later. So again, I just wanted to kind of prime you for prevention, and I would like you to think about prevention as you're listening to our presenter, and think about, as you hear this data, what kinds of things you can do with this data. There's the education piece, but there's also so much more we can do with this information. So I'm going to stop now and bring up the person that you all came here to see. We're going to have this presentation will be in two parts. Valerie will do kind of a part one, and that'll be about 20 minutes. And then we're going to do a prevention networking activity. And following that, we'll have a break, and then come back and hear the rest of Valerie's presentations. So Valerie is with the Office of, Valerie Clark with the Office of Justice Programs is here, and we're very excited. So let's give her a warm welcome. And is this one on? Is that on? I'm just going to take it. There we go. I know that one's on.
Hey, wait.
You can just X out of that.
Good morning. Thank you for all coming. And thank you, Amy, for inviting me. One of the main points of this whole presentation is to go over data. What data is out there? How can you access it? And then how can you use it? And I think that's what the activity you're going to do is going to go over. Okay. And we're going to go over this presentation a little bit differently than I had expected. So I'm sorry if that's confusing. Well, first, going backwards, I should say I'm Valerie Clark with the Office of Justice Programs. Those of you who work in providing services, you may be familiar with OJP as a state administering agency providing your grant money. I'm kind of separate from that. I'm in the Minnesota Statistical Analysis Center. Did anyone know that we had a SAC? One person? We don't advertise ourselves very well. On the handout, I have a brief description of what a SAC is. It's part of a national network of other state agencies that are supposed to collect and distribute any kind of criminal justice data, including victimization. And so the whole point of today is to go over different sources of data, official data, self-report data, and crime victimization surveys. I'm going to go ahead and just jump right to the crime victimization part because that is what your activity is going to be related to. So, okay, so crime victimization surveys, just one of the many different ways to get victimization data. The most commonly cited or the most popular source of victim data would be the National Crime Victimization Survey, which is conducted 2 times a year by the Bureau of Justice Statistics, which is the same agency that sponsors the Statistical Analysis Center. The NCVS is an ongoing collection. I believe it began in 1972, was majorly redesigned in the early 90s. It's a very large survey. They include over 90,000 households. And because they survey every individual within the selected household, there are more than 160,000 individuals. They include everyone in the household who is 12 years of age and older, so not just adults. Once a household is selected to be included, they are re-interviewed every 6 months, and that lasts for 3 years. I believe they throw out the first interview and then they just go collect data based on each subsequent interview, and they ask the respondents what happened as far as victimization within the previous 6 months. This survey is incident-based, meaning that they ask the respondent, were you assaulted within the previous 6 months? And then they go back to that assault and they say, you know, can you describe the offender? Were you injured during the assault? Did you seek medical attention? Things like that. The survey is administered in person the first time or via phone. What they measure in the NCVS, there's 2 basic categories. Non-fatal person crimes. It's a victimization survey and they're collecting data from respondents. So obviously they can't collect data on homicide. So all the violent offenses are non-fatal. They ask about rape or sexual assault, robbery, aggravated and simple assault, and personal larceny, which is like pickpocketing. They ask about household property crimes, including burglary, motor vehicle theft, and other types of thefts like stealing from your car or stealing from your property, not burglary. And then they also have periodic supplements to the survey, including extra questions about identity theft or more pertinent to this audience, stalking. How can you access the NCVS? There's 2 ways. If you are a researcher and you want to actually use the data, you could go to ICPSR, which I never remember what the acronym, Inter-University Consortium. It's sponsored by the University of Michigan, and they warehouse all publicly available data sets. And I have a link to ICPSR here. It's not user-friendly if you're not trained in how to collect and access data. You probably wouldn't have much success in downloading the data or using it. But if you want to actually just see the reports and the tables, then just go to the NCVS or the BJS's NCVS website. It's not a perfect source of data. Obviously, they're relying on self-reports, and you have to wonder, are victims comfortable disclosing victimizations, especially the very personal forms of victimization like rape or sexual assault? They're also interviewing everyone in the household. So if you have an intimate partner violence or domestic violence situation, Is the victim comfortable disclosing that, knowing that the perpetrator is also being asked the same question and knows what's going on? They might include non-criminal incidents, depending on how the question is asked. People might report things that maybe weren't crimes, and I'm thinking more of thefts, where if you ordered a package and it didn't come, and there was some dispute with the company, they might report that as a theft or a swindle. And because I'm going out of order, I say there are measurement issues. This is one form of a self-report survey. And self-report surveys always have this struggle with question wording. So how do you ask someone if they were sexually assaulted? How do you word that question very carefully to elicit the answer, being as broad as possible to include all forms of sexual assault, trying not to be too specific, trying not to just limit the question to assaults that happen by force. There could also be assaults that happen, when you were passed out, so there was no force. So there's always a struggle with how to ask the question. Plus, you're usually limited in space. You're limited in the wording that you can use. You want the question to be easily understood by people of all different education and reading comprehension levels. So wording is always an issue. And then there's how we can use the data, or estimation issues. Currently, because it's a national survey and they survey nationally, they cannot break out those data at the state level or any more at a lower geographic level than that. So you're only getting national estimates, and if there are state-specific issues, you're not able to use the data specific to your state. So that brings me to the Minnesota Crime Victimization Survey. Periodically, our sponsoring institution, the Bureau of Justice Statistics, gives us a pot of money to do with what we want. And periodically, Minnesota takes that money and uses it to administer their own state crime victimization survey. So it's not as frequent or ongoing as the NCVS. We're only able to do it once every few years, whereas the NCVS is constant. We're also only able to survey individuals, not entire households. And because we don't have as much money as the federal agency, we're only able to do it via mail and not in person or by phone, which limits us a little more than the NCVS. Our survey is also more prevalence-based, meaning that we're more measuring just the overall number of incidents or number of people affected. Because it's a paper survey, we're not able to drill down into each of those victim events and get more information on who was the perpetrator that one time versus the other time. Did you seek medical attention every time? So it's a little bit more limited than the national survey, but it's still valid in my opinion. Our office, the SAC, has administered the survey now 7 times, with the most recent administration in 2016. So each time we administer the survey, it's a little bit different in terms of how many people we sample, who we partner with. Sometimes we focus more narrowly on one form of victimization, like in the 2010 survey, there is more of a focus on domestic violence. So each survey is a little bit different, but overall, we try to be consistent in the question wording so that we can keep the same types of victimization and measure those events over time. So the 2016 survey we did in collaboration with the Wyoming SAC. The Minnesota SAC, in the Minnesota SAC is just me and one other person. We're a small office, but we did work with the whole Office of Justice Programs, some community agencies we reached out to work with in developing the instrument. I think John played a role. We sent the instrument to the Department of Health to look over, to add comments, to make changes. But for the most part, the Minnesota SAC developed the questionnaire, and it was largely based on previous questionnaires from the Minnesota SAC, as well as the National Crime Victimization Survey, because we want to be able to compare our results to prior results from Minnesota, as well as federal estimates. We contracted with Wyoming to actually distribute the survey and collect the data. This survey, for the first time, was mixed mode, meaning that we had an online platform where respondents could go to a website and enter their responses. And for people who weren't able to go online or didn't want to do that, we also mailed a paper survey. So it was completed online or via old school mailed paper survey. Our targeted population, unlike the NCVS, we were limited only to adults, not people 12 years or older. And our sampling frame, or that the pool of individuals or households that we selected from, included every Minnesota household with a mailable address, which we obtained from the U.S. Post Service, or not we, Wyoming got from the Postal Service. The survey was actually administered as in mailed, and responses were collected between October of 2016 and February of 2017. We ended up getting a total of 1,560 completed surveys, and that was out of 6,500 that were mailed. That is a 25% response rate, which I know to a lot of people seems low, but that's usually what you can expect with a mailed survey. So it's important to keep that in mind, you know, when you're thinking about how representative are these data of Minnesota. A majority of our surveys were completed on paper. We found that people preferred the older method still. We're not quite there with online surveys. And more than a quarter of the completed surveys came from racial or ethnic minorities. And that is because we purposefully sampled or oversampled neighborhoods where there were a majority of racial or ethnic minority respondents. In past administrations of the survey, we found that we didn't get a big enough sample of racial and ethnic minorities to really be able to look at victimization more specifically in those populations. So we wanted to make sure we got an adequate sample, that they were represented in the sample. So we divided the state up into two strata. The first would be block groups or census local area neighborhoods where the majority of residents were not white, so they could be Hispanic or any other race. So majority minority block groups, and then the rest of the state were majority white block groups. And we selected not quite an even number, but about half and half from the majority minority and then from the others. And that got us with the final sample, which had a disproportionate representation of minorities, which we had to correct for so as not to skew the data with sample weights. And I think I'll just give sample weights unless anyone has any questions about what that means. But to summarize, making sure that individual, or that the results from some groups didn't skew the entire results from the data. But if anyone has any questions about that, I can answer it after. So what sample did we end up with? We had an average age of about 47, which is a little bit older than the average Minnesota population. About 50% or 51% female, so about 50-50. 83% of the respondents were white, non-Hispanic, and this is after the weighting to correct for the disproportionate minority sample. A little over half were married. A large majority were heterosexual. Most of them were homeowners. A majority, 70%, lived in the home that they owned. A a large majority, 73%, had completed some form of post-secondary education. I thought that the household income in this sample was a little bit higher than you'd expect. About 50% or more had a annual household income of more than $60,000, and 64% were employed full-time. So not exactly a mirror of the Minnesota population, but pretty close. And I'm going to present some select results from the survey. We talked about only going through the results that are more pertinent to this audience. But the survey included questions about property crimes, ID theft, fraudulent credit card use, things like that. But just for today, we're only going to go over stalking, domestic violence, and sexual assault. So stalking victimization is very hard to measure. How do you ask this question? A lot of stalking behaviors on their own are not illegal, not always threatening, not always a problem, but when done in some kind of pattern by the same person, then they can be threatening or dangerous for the victim. So to measure stalking victimization, we first started out with kind of a checklist, a series of behaviors. Did someone do these things to you within the past year or not? And I should have brought the actual questions, but did someone harass you by the phone, through some form of written communication, which could include social media or Facebook, Instagram? Post unwanted photos of you online? Follow or somehow spy on you physically or digitally? For the first time, we asked about someone posting explicit photos of you online. We were trying to get at revenge porn, which is now a crime in Minnesota. So we went through this whole list. Did this happen? Yes or no? And then after asking each of those questions, we followed up with, did the same person commit more than one of these activities within the previous year? Or did the same person commit more than one of these actions on more than one occasion? And the whole point of that is because the BJS considers that to be a pattern consistent with stalking. So looking only at those people who checked yes to one of those individual harassment behaviors, about 38% reported that the same person did this more than once or did this on more than one occasion, did more than one of those activities. That represents about 10% of the entire sample. So that would mean that about 1 in 10 Minnesotans reported that they were stalked within the previous year, which compared to other surveys seems a bit high. I think the NCVS found about 1%. My conclusion is that we didn't really ask the question right. We could probably improve that question in the future. In a majority of those who reported that they were stalked, over 60% reported that that was by a current or former intimate partner. And if any of you have questions about the items or the findings, please stop me at any time. Moving on to domestic violence and sexual assault. And remember that all of these victimization events are only within the previous 12 months. We're not asking about lifetime victimization. So in asking people whether or not they were punched, kicked, burned, any sort of physical violence by a current or former intimate partner, and we tried to use an exhaustive list of what that includes. It could be a marital or non-marital partner, just someone you just were on a first date with. We found that about 1.5% of the respondents reported that that happened at least once within the previous year. A large, overwhelming majority of those reported that that happened more than once within the previous year. And about 80% reported that they reported the most recent incident to the police, which, does that seem high? Yeah. John? Sorry.
So I'm just wondering if you also asked if they had sought medical or hospital treatment for their IPV or sexual assault, et cetera? Oh, you got it in the, okay. Sorry.
No, it's a good question. Thank you for asking. Yes, we did ask. So this was the only violent victimization question where we actually asked this follow-up question about seeking medical help. And I don't know if I explained this. So the NCVS is incident-based, where they drill down into each reported incident. Our survey, we're not able to be incident-based, but we tried to approximate incident-based by asking people about the most recent incident that happened within the previous 12 months. So in asking people during that most recent intimate partner violence victimization, did you seek medical attention? And only 7% reported that, yes, they did. And does 80% of domestic violence victims reporting to the police, does that seem kind of high? Is that what you find in your work? So we only have a sample of about 1,500 people. Of that 1,500, about 1.5% reported that they were victimized. So that's a small actual number, I believe about 22 actual respondents. So whenever you have a sample that small, getting accurate estimates, like of reporting to police or repeat victimizations, you're gonna get not reliable estimates. So I wouldn't put a lot of stock in that 80% estimate reporting to police. We asked about 2 forms of sexual assault. Any form of unwanted sexual, I can't remember how I phrased the question, any form of unwanted sexual contact by anyone that didn't actually involve any form of penetration. So not just in the traditional sense of penetration, but any form of penetration by a person with objects, anything. We found that about 1.3% of the respondents reported that they were sexually assaulted without penetration. More than 3/4 reported that that had happened more than once within the previous year, and less than 10% reported that most recent incident to the police. And then last, we asked about sexual assault with penetration, and we try to be as exhaustive as possible in that question, trying to describe what this could include. And we found about 0.1% reported that that had happened within the previous year. So I think that was an actual number of 2 respondents. Both of those respondents reported that that had happened more than once. Neither of them reported whether or not they reported that event to the police. Yeah.
Off the top of your head, do you remember how much overlap there was between IPV and sexual assault without penetration? Do you remember how much overlap there is between IPV and sexual assault without penetration?
I don't recall pulling that up, but we did ask the victims of sexual assault who committed that act. And we found that a majority of the perpetrators were a current or former intimate partner. And this is only for sexual assault without penetration, because those 2 respondents didn't reply to this follow-up question. So you could say that a large majority of those events were partner violence. And a lot of people look at these numbers like 1.5% for intimate partner violence or 1% for sexual assault, and they say, that seems really low. Like, there's no way that could be right. We have to remember 2 things. First, this is self-report, so it very likely is an underestimate that we can be sure of. But 2, this is within the previous 12 months. So these results are more or less consistent with the national survey, where we ask about incidents only within the previous 12 months. When you ask about lifetime victimization, that's where you tend to see the much higher reporting of incidents, where you have 1 in 3 were victims of domestic violence, or 1 in 4 victims of sexual assault. And before comparing these results to other survey results, keep in mind not only the time frame, but also the wording of the question. Are you including any form of unwanted sexual activity, or are you limiting it to a certain type of sexual activity? So, these are likely lower than what we actually, what is in the population, but they are consistent with other similar surveys. Yeah.
So I'm wondering how this compares with the previous crime victimization survey.
Thank you. We'll just jump straight to that. So going back to the surveys, 2001, 2007, 2010, and 2016 Minnesota crime victimization surveys, having 1.5% reporting domestic violence, that is a very slight decrease compared to like 2001. And I'm sorry, these aren't dark enough. So in 2001, about 1.9% reported domestic violence victimization. So it's only a very slight difference. And when you're measuring something that has low actual numbers in the survey data, again, you get unreliable survey estimates. It's harder to measure something that is a little bit less frequent. I think I did calculate it. It is a statistically significant difference, but it's not a huge difference. For sexual assault without penetration, which is the middle line, 2001, there was about 1% of respondents reporting that, compared to about 1.3% in 2016. So a very slight increase compared to 2001, but more than double compared to 2010. Yeah, John? Were you going to say something? Yeah, go ahead.
I find this is, to me, one of the most important graphs that comes out of this, because whatever biases are included in the questions, compared to previous years, we can detect trends that are going on. I look at the sexual violence one, your middle line there, with that significant jump up. We're in the process of analyzing our hospital discharge data right now. We're seeing the same kind of increase. After years of decline in sexual violence being picked up by the crime victim surveys, and even with to some degree with our hospital discharge data, we have seen this bump up for 2016. So it looks like society is changing right now, and your data affirms what we're finding in our hospital discharge data.
Good. I mean, not good, but it's good to have
tends to
data that's
validate.
consistent with other data.
Right. It seems to validate each other, so because it's two different things measuring related but slightly different behaviors, but they seem to be telling very similar kinds of stories.
And after the break, we're going to talk about official data. And because you mentioned the injury data, maybe you should take over that part.
My question was, in 2001, how many reported compared to 2016? We know 1,500 reported.
More. I know in the past administration of the surveys, there were a lot more respondents. And I cannot remember for 2001, but I know in the past it's been more like 6,000. And this survey was designed, and the whole survey plan was designed before I even started in this job. So what they were thinking with trying to get 1,500, and that was their target. I don't know why that we were limited to that, actually. Yes.
So in the questions for, sorry. So in the questions for sexual violence or sexual assault without penetration, did you include examples of what that could possibly look like you did for the other others as well? And was it the same kind of list like every year that you did this, 2001, 2007, or did you make some changes to that could possibly account for the number, the increase, I guess?
Yes. I should have actually brought the survey instrument with me. For 2016, the question was like grab or fondle you or do anything unwanted. So it wasn't a long list of examples of what that could include, but we tried to include some of what we were thinking. And how does that compare to the previous years? It was pretty consistent, pretty similar, the question wording. Although asking about who did it was expanded more to include all sorts of different types of intimate partners or other people who could perpetrate that. Yeah.
And to follow the other excellent questions, could it also be the overrepresentation of some of the racial groups that you didn't have previously? Do you have any race-specific information, or are they just so few in these categories?
Well, the sample weighting, the whole point of that is to correct for the disproportionate representation of minorities in the sample. But we correct for it, but are we completely correcting for it? It's possible that could be part of what's going on. And what was the second part? And I didn't break out these results by racial groups, more because there was just such a small actual N. You're not really supposed to break out a sample when it's that small, when you have like less than 25 people, because those estimates would be not very accurate or helpful. But yeah, thank you. Good questions. And then actual sexual assault with penetration. Again, these are very slight differences. It looks like it's slightly down, but when you're measuring something that is less frequent in the population, again, it's hard to measure and the results aren't entirely accurate. There's a lot more error. Did we miss anything? Going back, again, the domestic violence victims were asked 2 additional follow-up questions. So the first was about seeking medical attention, and we see that very few sought medical attention. And then the other question was about were any children present to witness the most recent assault? And a large majority, 71%, reported that yes, children were present to witness the most recent assault. And then again, a majority of the sexual assault victims without penetration, because that's the only type of sexual assault where we had this result or this question answered. A majority reported that a current or former intimate partner committed the sexual violence. And we have Annie.
Oh. Sorry, you might have gone over this, but I just might have missed it. But the seeking of medical attention, that was specific to domestic intimate partner violence. Did you have that question or that information for victims of sexual assault, either forms?
In the past, that has been a part of that question as a follow-up. In this survey, due to space limitations, we eliminated that question.
Okay.
I know, it's a hard choice when you're trying to fit a survey. We had 8 pages to work with, and we had to cover a broad range of victimization types, and we really agonized and wrung our hands over every question to include or not include, and that was unfortunately one of the cuts compared to previous administrations. So how does this self-report victimization compare to the official data? And after the break, we're going to talk about official statistics from the Uniform Crime Reports. And you may have heard recently, there's a lot of talk about how serious crime is way down. I think the Minnesota Star-Tribune, the headline was serious crime, the lowest it's been since the 60s. So the rate of rape in Minnesota, according to official data, which is largely based on arrest, has been down since 1995, which is where this graph starts. Looking more closely at 2014, there's a slight uptick. And as I'll talk about after the break, there was an official change to what the UCR counts as rape. But the point is that serious crime is down. That's what people keep on saying. But it's important to keep in mind that not all forms of serious crime are down. And as John said, it looks like sexual assault is one of the serious types of serious crime that may not be following the trend for all forms of serious crime. And last, another question that we included on the survey, and this is another question where it would have been better to have an incident-based survey where you could ask about each type of victimization and whether or not the victim reported that some kind of bias based on gender, race, age was the motivation. So how we asked this question was, people reported victimizations, and then at the end of the survey, anyone who reported that they were victimized in any way, and that could include property crime, as well as violent crime, did the victim believe that their victimization was motivated by any form of bias or prejudice? A majority actually didn't even answer the question. But of those people who did answer the question, more than half didn't feel that the victimization was motivated by any form of bias that we provided. But of those who thought that their victimization was motivated by some form of bias, the most common answer would be gender with 4.5% of victims, followed by race, 2.5% of victims. And that's all I have for results from the MCVS. I think now we're going to take over for a break, exercise. I don't know which order. So.
Thank you so much for all of that really interesting data and great questions from the audience so far. So Valerie will be back up after the break, so to be continued. Just going to pull up the spectrum that we all put together collectively. Okay, so if we think about the results and kind of what we collectively came up, that's up on the screen right now, I'm thinking about sexual violence prevention. So I know we were doing kind of more general public health prevention. Now if we kind of shift and think about specifically sexual violence prevention. So you guys should have this nifty handout. It has the spectrum and some resources on this side. On the back side, there should be some Post-it notes. So if everyone could take a few minutes and think about sexual violence prevention and how you can apply it in your own personal and professional lives. And we're focusing particularly on the top half of the spectrum of prevention. You guys also had a spectrum sitting on your seats to refer to that you can keep in your wallet, purse, handbag. If you could look at the level 4, which should be the blue Post-it, and they're color-coded on your sheets. So level 4 is the fostering coalitions and networks, the blue color. Level 5 is changing organizational policies and practices, which is the green Post-it. And then level 6 is policy legislation. So that's the pink Post-it. So if you could color code them by that, it's color coded on your sheets also. Take a few minutes and think about how you can apply this, what examples you can come up with. And then if we could post them, there's some color coded on the back wall sheets. So if you could post them up color coded based on that. And then during the break, we're going to break after this activity. During the break, if you could find someone in the room who you do not already know, part of it's the networking, get to know other people who are preventionists. Yay. If you could find someone who you don't already know and then share at least like one maybe that's kind of stuck out to you, example that you came up with. And then we'll come back and Valerie will continue her presentation. Thank you all. We had some great conversations I overheard about how to prevent sexual violence in our work and in our personal lives. Thank you everyone for sharing your ideas. I saw some people being able to do the gallery stroll and checking out other people's responses. They will be up until after the presentation also. So if you didn't get a chance to read all of them, feel free to afterwards. Just wanted to do a few highlights of some examples that we've seen kind of that people put on the boards in the back of the room. And actually before we started, I was having a conversation with Cheryl and she shared something that she knows is kind of going on that sounded like a great example of organizational policy and practice change. So Cheryl, if you wouldn't mind sharing that example with us.
On Sunday in Peru, the Miss Peru beauty pageant occurred, And I was so happy to see that in a part of the pageant where they come in swimsuits and normally give their name, what city or area they are representing, and their measurements, bust, waist, and hips. This year they gave their name, where they are from, and my measurements are, and they gave a statistic about violence against women and children in their country. And I was so happy to see that. I put it on the our intranet that we have at Cornerstone so everybody could see that and be inspired by it. It's about time.
Thank you so much, Cheryl, for sharing that amazing example. And that's kind of an organizational policy change that instead of giving measurements, which is clearly objectifying women, that we're then talking about sexual violence and intimate partner and violence against women in the communities. So great. I'm going to share a few more examples. So for the fostering coalitions and networks, someone said, complex unity, recognizing that sexual/domestic violence is a form of oppression and work to end other forms of oppression in conjunction with working to end domestic violence and sexual violence. Expand our movement, unite and do anti-oppression work together. For the organizational policy and practice change, someone talked about affirmative consent policy at the U of M and additional resources for Aurora Center, which is the sexual violence prevention or sexual violence center on campus, to engage men/masculine identified/male staff and students. And then for the legislative and policy change level, the example is building a broader understanding of intimate partner violence into law, increasing protections where folks are vulnerable, for example, housing and courts. And then specifically for sexual violence, comprehensive sexuality education and relationships, a broader increased options for justice other than law enforcement, and increased support for tribal and other highly affected communities. So thank you all for sharing, and feel free to check all the rest of the responses out after the presentation. So I'm going to pass it back over to Valerie to continue her presentation.
Okay, so we're going to go back to what I had originally conceived as the beginning of the presentation. Again, we want to go over all the different ways or some of the different ways that people can obtain victimization data. So the three basic categories of data would be official statistics, like counting arrests from the UCR, court charges, so the Minnesota Court Information System, counting just charges, injury data, which John can talk more about. I've never used those data, so I'm actually very unfamiliar with them. Self-report surveys, which the crime victimization survey is kind of a subset of self-report surveys, but some common surveys would be the NISVS, which is an acronym I'm blanking on right now, but it's a survey conducted somewhat regularly, sponsored by the CDC. The National Violence Against Women Survey, which was sponsored in part by the CDC, but it was a one-time survey conducted in 1996. And then going for a more local example, the Minnesota Student Survey, which is sponsored by a partnership between different Minnesota agencies. And I'm just going to talk about an example of each official statistics and self-report surveys. So going on official data, the FBI's Uniform Crime Report would be probably the most commonly referenced source of data on crime. So it's the most widely used. Anytime you see a headline in the paper about crime, which direction it's going, it's probably based on the UCR. It has a high rate of participation by law enforcement agencies. So the number of law enforcement agencies that report data that contribute to the UCR represents 90% of the total population in the United States, and then 94% of the Minnesota population. They generally provide the reporting on an annual basis. So usually in July of each year, they would release the data about the year before. Did crime go up? Did it go down? The data are generally reported statewide in Minnesota. They can be broken down into by agency or more typically by county level. But when you break down the data by lower geographic regions, you generally only get broader categories. So just all forms of serious crime versus forms of less serious crimes, not usually specific types of crimes like homicide or assault or rape.
Are we able to request the UCR statistics from an individual police department, and how willingly are they, or how willingly will they give up those statistics to us?
Well, it depends on the department. I know that I regularly request data from St. Paul and Minneapolis, and they are generally pretty open with their data.
Okay.
You know, will you get exactly what you want? You know, they only have the data broken out a certain way, like by offenses. So you can ask for
Okay.
it.
So my next question then, where are we at with NIBRs? Because I know UCR.
Man, you're jumping at me.
UCR is going to go away,
Yeah.
and NIBRs comes in 2021. So where's Minnesota in that transition?
I'll actually get to that one in a second because it relates to, but yeah. No, it's a good question. So still with the UCR, which is not an incident-based form of crime reporting. They're just counting offenses or arrests. For most types of crime, with few exceptions, they don't collect that contextual data, like the victim-offender relationship, injury, characteristics of the victim, sex, race, things like that. So offenses measured by the UCR are broken into two categories. There are index crimes or Part 1 crimes, which are generally the most serious forms of crime. So homicide, rape, robbery. Here's the full list. Of interest to you guys would probably be rape, and then human trafficking, which is the most recent addition to the UCR to Part 1 offenses. Non-index crimes, which are basically all other crimes not included in the Part 1 category. It includes a long list, but among that list are other assaults, which are generally less serious, like misdemeanor assaults where there wasn't serious injury. Prostitution and purchasing prostitution. So misdemeanors again, things that don't fall into the category of human trafficking. Other sex offenses, family, children offenses, which are generally like neglect or things like that. And then several more. What is not measured would be domestic violence, unless you look at homicide, which accounts for only a small portion of domestic violence. Because they don't ask about the relationship between victim offender for assaults, you're not able to measure domestic violence. So it's subsumed under the category of aggravated assault or assault. It's included in there, but you can't parse out domestic violence. And then stalking, which is also subsumed under, I believe, other assaults, unless it rose to felony level. So they're not measured separately. So the UCR is a very poor measurement tool if that's what you're trying to measure. And wait for the remote or the microphone.
Is there any way, or is there a question on any of these indexes that bring out if a gun was involved in the process of perpetration of the crime?
Yes. So just to clarify, this wouldn't be a survey. It's more a counting of official records, so official arrests or reports made to law enforcement. And for some of those crimes, definitely homicide. Possibly aggravated assault, I cannot remember. For homicide, for sure, they do ask whether or not a firearm was involved. But not for most of the types of offenses do they get at that. As John was alluding to, there's a new, better system that is supposed to get at things like that. How can you access UCR data? There's a couple of different ways. If you're interested in national data, I have a link here to the FBI's UCR data tool, which they allow anyone to quickly pull up a table that might have a specific category of arrests over years, nationally, or state-by-state comparisons. And I put these links on here knowing that Amy is going to post this online so you can access it later on. If you're only interested in Minnesota, every year the Bureau of Criminal Apprehension puts out the crime book every July, counting the previous year's statistics. And I have a link to the BCA's crime books. The crime books are, for most years, just PDF files, which aren't very user-friendly if you're trying to calculate data statistics on your own with what's not provided. In the most recent 2 years, they've put out Excel spreadsheets to complement the crime books, so you can do with the data what you want. You can also just ask for it. In the tables or in the crime books, if they don't put out a specific table that has exactly what you need, the BCA it's a government agency, so they are open to public data requests, and they usually do provide those data as long as it's reasonable. And I request it often, and they always give me the data. Another possibility would be the Minnesota Criminal Justice Dashboards, which is an effort by my office to take all of the criminal justice data that's out there publicly and put it into Tableau. Is anyone familiar with Tableau? The new trend in data visualization or analytics, where I've taken all of the publicly available data based on the UCR arrest, based on prison data, court charges, and put it into Tableau where the public can manipulate the data, request certain data to be broken out by race or by sex, by specific type of charge. So if you have any questions about that, if you get a chance to look at it and you don't see a dashboard that meets your needs, I'm actually very open to creating more dashboards that have different types of data that would be helpful to people. So if you want something different, just ask. Sorry, I've had a chronic sore throat for like 2 weeks, and now I'm starting to lose my voice. There are, of course, some major problems with the UCR for the purposes of measuring victimization. I mean, in general, but for your purposes specifically. And this is by no means an exhaustive list of validity issues that you might have with the UCR, but these are the most pertinent to everyone in the room. First, and most importantly, you're relying on arrests or reports to law enforcement. And as I'm sure everyone in this room knows, crimes like sexual assault, domestic violence often do not come to the attention of law enforcement. So you have a serious case of underreporting. It's hard to measure what you don't know, but based on crime victimization surveys, when they ask people, did this happen? Did you report it to police? Based on that, they've estimated that anywhere from 34 to 45% of rapes and sexual assaults, only 34 to 45 are reported to police. So a majority are not reported to the police. And then even fewer of those will actually result in an arrest. So if you're looking at UCR, which is largely based on arrests, most crimes are not being counted. As I alluded to earlier, they're only counting arrests of the offender. So obviously you're not counting the number of victims or any of the characteristics of the victims. So one offender arrested, there could be many victims. There could be also many other crimes by that offender that never came to the attention of police. So it's a poor estimate of victims, of even prevalence, and then of types of victims. There are a few exceptions. The BCA has recently started collecting supplemental reports on human trafficking victims to count the number of victims, the race of the victims, age, other specific characteristics, but that's only very recent. It's a voluntary report by the law enforcement, so it's also not representative of all human trafficking offenses. And then homicide, they've always counted extra characteristics of victims. Yeah. Or Amy, sorry.
Pardon me, when it talks about as far as resulting in arrest, is there data available on prosecution and how prosecutions are finalized? What happens at that point?
Well, so that would move into Minnesota court information systems. As far as they have charges and convictions, but the categories are kind of broad. So if you're trying to look at sexual assault, that sexual assault might be counted as a different type of charge depending on the police process and the prosecution. It might not end up in a conviction of the original offense. So it's a very rough way to measure certain types of victimization.
So you can't really correlate arrest with prosecution and then outcome. There's no.
I wouldn't. Yeah. Especially, I don't know how other states are, but I know in Minnesota, we're still working on improving our court data of being able to aggregate it and measure specific types of offenses. But right now, it would be too rough of an estimate. And if anyone wants that, I know, do you have experience with court data?
JJ. Sorry.
I don't know if I actually have.
Oh, it's okay. I'm sorry. I don't want to put you on the spot.
I think that some court data came out in the last year, right?
I was on leave for a couple of months,
Oh,
so
yeah,
I
yeah.
missed
I think
it.
some court data came out, and the person who was in charge actually sent me some spreadsheets, but like not any pretty dashboard kind of format. So
Yeah.
but it's pretty rough.
So in a project that we had in the early 2000s, looking at intimate partner violence, we had actually gotten a court order and got a copy of a subset of the court data, which we then linked with some of our other data to, look at different aspects of intimate partner violence in there. So I just throw that out as a possibility. Somebody here might be looking at being able to go in and generate the statistics that we need here as a community for SV prevention. That might be useful. We could get a court order and get a copy of that data set. Maybe Valerie and you and I need to talk and get Ruby in this conversation and
Well, I know someone recently asked me for domestic violence statistics at the county level, and because UCR doesn't have a specific category of domestic violence, I thought, okay, court charges, that's the only way I can officially measure that. And, they do have specific charges that are listed in the data that specifically state domestic violence. So you can count that, but knowing that, there are a lot of incidents that will never be charged, that will be dropped, that will be pled into something else. So, you can use it, but knowing that it's definitely an underestimate. And then back to UCR, they have a pretty flawed definition of rape. What law enforcement agencies will count as rape and report to the main central collection agency, like the BCA. That can already vary from agency to agency, what each law enforcement agency will count as rape. But the official definition that agencies are supposed to go by, up until recently, was even more flawed. It was the carnal knowledge of a female forcibly and against her will. So obviously there are some major issues with that. Only force, only female victims. It's not a broad enough definition. So in 2014, they did revise it to include any form of penetration and any gender of victim. But it's still a flawed definition. It's still probably not broad enough to include all the different types of sexual assault that happen. And a lot of times you have law enforcement agencies still only counting sexual assaults that came by force and not by some other means. So as John said earlier, the FBI, in partnership with specific states like Minnesota, they're working on a new reporting system that is supposed to supplant the UCR. It's the National Incident-Based Reporting System, or NIBRS. So it's supposed to be an improvement over UCR, because now for a much broader array of serious offenses, no longer just 8 offenses. I think there are 40 what they count serious offenses. They're going to include more contextual information, like the victim characteristics or the victim-offender relationship, more types of serious offenses, and because you're able to look at that victim-offender relationship, and they're also looking at domestic violence as its own category, you'll finally be able to measure domestic violence. NIBRS was initially kicked off in the 80s. I don't know what the original implementation plans are, but I think they thought they would have it fully implemented by now. But as of right now, only 15 states have fully implemented the NIBRS collection system. Minnesota, I know it's public safety, BCA working on it, but I'm actually totally separate from that. And I do not know right now where the BCA is with implementing NIBRS. What I do know is that the UCR is supposed to sunset. And this is 2012, that should be 2021, sorry. NIBRS should be fully implemented by 2021, and they're going to cut off the UCR collection system by 2021. So everyone is supposed to be able to collect NIBRS data by then. But I think you know how government works, and there's always extensions. So I mean, if I was a betting person, I wouldn't put my money on 2021. So moving on to other types of victimization data, self-report data, which again is the broader category that crime victimization surveys are included in. There are many different types of surveys, and what I mean by self-report surveys is where you administer a survey instrument to some population. So a school, statewide. One local example would be the Minnesota Student Survey, which is a survey that is administered to mostly public school students in Minnesota every 3 years. And I say mostly public schools, but they do also include tribal schools, ALCs, charter schools, and even juvenile correctional facilities that have an educational program. It includes students in grades 5, 8, 9, and 11. We last administered the survey in 2016. The next administration will be in 2019. And during the 2016 administration, 86% of school districts were represented. So 86% of school districts had at least one of their schools participating in the survey. And among response rates from enrolled students. From each grade, we found anywhere from 61 to 73% of enrolled students were completing the survey. The student survey asked students several different questions. I mean, they include questions of health, what you eat, and so on, but they also include questions about types of offenses they have committed and types of offenses they have been the victim of.
Does that also include students with disabilities? And is it in a format that's accessible?
Yes, I'm on part of the interagency group from health, education, human services, and public safety. We all work on the survey together. And they always work to improve the survey to make it as inclusive as possible. So they do include English language learners, special education students, and then other special populations like students in juvenile correctional facilities. And I know even right now, talking about the 2019 survey, we're working on how to make it even more accessible, like having audio options for people who don't read as well. So yeah, we do try to be inclusive, but to be sure, some people do get left out. So they asked the students about, I have two categories: perpetration, like sexual harassment that they have committed, assaults, like any non-sexual assault, bullying, things like that. As far as victimization, they're asked about any emotional, physical, or sexual abuse that they experience at home by parents or other adults in the home. Whether or not they've witnessed domestic violence at home. Any kind of emotional, physical, or sexual abuse that they've experienced by an intimate partner. And then they also ask about bias crimes, like bullying related to their race, gender, religion. How can you access student survey data? The Department of Education puts out a data tool where you can build tables based on the survey items and across different years. They also put out a trend report after every administration, so you can see trends in things like sexual assault. And I think actually I put the ICPSR as a mistake. I don't think that should be there. I think what I meant to say is you can also just ask for the student survey data. It is collected by government agencies. It's meant to be accessible by everyone. So if you are a researcher, you can request these data, and given a reasonable request, get these data for yourself to use. It's not on ICPSR. But again, every type of data has validity issues. So just like the crime victimization survey, you're relying on self-reports. And among young people, you have to wonder, are people comfortable disclosing all this information in a survey? Are some students even aware that they've been victimized? Sexual assault comes in many forms, and someone may have been sexually assaulted, but they, in their head, don't count that as a sexual assault. So again, probably an underreport. In survey data, you're often grouping less serious offenses with very serious offenses. It's very hard in a paper survey, especially, to separate offenses that are offenses, but would never come to the attention of law enforcement, versus offenses that are very serious and should come to the attention of law enforcement. I'm not sure how familiar you are with the great debate of the 70s over domestic violence, where self-report data found that women are just as violent as men. They commit domestic violence at the same rate as men, versus what you all know based on injury data and official data, that no, women are actually not as violent as men. They don't perpetrate serious domestic violence at the same rate. So you have this problem with any form of self-report data, grouping the less serious with the more serious. And again, you have measurement issues, just like with the victim survey, how you word and ask a question can impact how people understand it and how they answer it. And then we have this additional problem with the student survey specifically, in that we're very constrained in how we can ask questions. Parent groups, legislators, they don't want anything dirty in the survey. So you can't get down to the nitty-gritty and asking people about victimization. So like in the statewide victimization survey, where you can include examples of what sexual assault includes, you can't do that in the survey data. I think you can ask about sexual intercourse. You can't ask about oral sex or any other kind of penetration. So that limits you in what you can measure. And I just pulled up a couple examples of the survey questions included in the Minnesota Student Survey. And these questions are not asked of the younger students, only of students in grades 9 and 11. Does anyone see any issues with these questions? On the left, these are questions more about abuse at home, physical, emotional, sexual. And then on the right, that's how they ask people about intimate partner violence. Does anyone see any issues with these questions? Yeah.
With 63C, there could be a little bit of an issue with pressuring you into sex when you didn't want to. It's not including what coercion might look like or what pressure means. So someone who maybe is in a relationship would be like, well, I wasn't into it, but then it was okay, so that doesn't really count. Could be missing something there, maybe?
Yes. And Amy?
For someone with a physical disability that requires an adult to support them, they might not know if they're being touched sexually or not, especially if they haven't been had experience in sexual education that talks about that.
So, well, one of the things right away that I look at, like with 63C, I'm wondering about the role of alcohol and other drugs. You know, we talk about alcohol as being the #1 date rape drug, and we're looking at that role of alcohol and trying to describe alcohol in the as its relationship to sex amongst young people. 63B, I'd like that to parallel number 71. I'd like slapped, hit, kicked, punched, or beat. That's just to bring more parallelism into the survey.
Yeah. Yeah, these are all good examples of how it's not a perfect measurement. And even looking at question 63, so you can only be pressured into sex by an intimate partner. So you're eliminating a lot of other sexual assaults that could happen by anybody. So yeah, it's definitely not a perfect measurement. There are always a lot of changes we'd like to make to it. But again, we're kind of constrained in space, the parent groups, the legislators, but still always working to improve the survey. And that's it for the examples of types of data I was going to give. So just moving to the conclusion, there are many ways or several ways to measure victimization. They all have their own issues. There's not yet a perfect way to measure victimization. As John pointed out earlier, with looking at injury data, comparing it to survey data, it's always important to look at all the different sources of data depending on what you're trying to measure and weigh them against each other. Does this survey result, is it consistent with other survey results? How does it compare to the official data? You always have to weigh the data against each other. And again, the public or popular media might focus on one source of crime data, like the UCR, to measure trajectories in crime, but it's important to know that not all offenses are following the same trajectory, and that may depend on what source of data you're using. So that is it. Oh, and by the way, if you want to access the Minnesota Crime Victimization Survey, the full report and the executive summary are online, but also you can just ask for the data. It's a public data set that we collected for Minnesota to use, so it is available to people who would like to use it. And that's it.
Any final questions? John?
So when is the next crime victim survey for Minnesota going to be administered? And what opportunity will we have to influence the questions on it?
It's a good question. So the Bureau of Justice Statistics, every year they put out this pot of money for my office to apply for. They put forth important topics or ideas that they want pursued by the states. I know that this year they're not going to offer the crime survey as an option. Maybe next year, hopefully next year. But the next time they put it out for us to apply for, we will definitely apply for it, and we will definitely reach out to other like CASA or MnCASA Health to help creating the survey or what should be included.
Valerie, thank you so much. Any other questions for Valerie? Okay. Well, thank you again. This is so important. We need this. We need good data for our prevention work. We will be posting her, Valerie's PowerPoint presentation, and it'll have live links on it. Valerie, of course, is a resource for this kind of data, and also John Racer. I think we keep hearing John in the back of the room. Who's John? Who is John? So, John, I'm putting you on the spot. That's why I left a mic with you. Would you just say a little bit about what you do in your work and how that supports everyone's work around this issue?
Yeah, sure. So I'm the epidemiologist supervisor for the Surveillance Epi and Analysis Unit in the Injury and Violence Prevention section at the Minnesota Department of Health. That's the administrative aspect. What I also function as, just personally, when I started out in my career, I was doing this is starting in about 1993, I was doing all the injury and violence epidemiology at the state health department, drug overdoses and the sexual violence and car crashes and traumatic brain injuries and burns and spinal cord injuries and all that. And as time has gone on, we've gotten different pots of money, and we have epidemiologists who do a lot of these things already, and I get to be the supervisor of all those, which is fun. But in the area of sexual violence, we actually haven't gotten the funding for a sexual violence epidemiologist, which is both, for me, good news and bad news. The bad news is we don't have a full-time or even a half-time person doing this. The good news for me is this gets to be my area of expertise. This is the area of epidemiology I still get to do and still get to look at and still get to be involved with. And so I find that very interesting. One of the things that we do, but I'm really busy with all the other things. So one of the things that I get to do then is we have interns that come in and look at who need to have a project or work on some data. Often EPI students from the U of M, but also from other graduate programs at the U or at Metropolitan State or whatever, where they're looking for a project, including McAllister University. They've been sending over people. So I get to have the opportunity to direct some of their activity. And for example, right now I do have a U of M EPI student looking at the hospital discharge data. And I mentioned that we saw an uptick in this 2016 data, and that is a concern. One of the things that happened just for us in our hospital discharge data is they changed the coding system that they use with hospital discharge data from 2015, or beginning in the fourth quarter of 2015, which has caused an increase in counts of a lot of different kinds of injury and violence. We saw this with the opioid overdose, the drug overdose. And so the grad student that I'm working with now, we did see an increase, and the coding system does create an increase in sexual violence, but we actually saw this increase beginning in the first quarter of 2015. Now there is quarter to quarter variation and all that, but we're seeing this uptick that is going up even before we change the coding system. So we saw some data here that Valerie presented today that shows some increases in the most recent years of available data. We saw it with the crime victim survey. We saw it also your arrest data. And all of this, you go, well, there could be bias in here, and and maybe it's not statistically significant increase, and blah, 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 all these different things. Flip side, we're seeing it in several data sources. So you folks are really the first kind of to see some of this increase. I think we're going to have to get all of our ducks in a row to, before there becomes an official pronouncement on this. We might need a couple more data points, but you folks are seeing this, and register against this with what your own practice is, and is this consistent? Because it's looking like after years of decline, or at least being flat, we may be seeing an uptick in sexual violence, and I think we're going to be on the lookout for that in our different data sources. Amy, does that give you enough?
I should have said, come up front, John. Boy, and that was on the spot. Imagine if you had planned something. Yeah. No, that's really great. Thank you. And is it okay if folks have questions?
Yeah, and I'm also going, I was visiting with Ruby from the U of M here just a little while ago, and thinking about with Valerie and with the exercise that you gave us. One of the things that SAMHSA did, the Substance Abuse Mental Health Services Administration, required of every state in the years past that they funded was to do a SEOW, a State Epi Outcomes Work Group. And that's been in existence in Minnesota for a long time, but that was to deal with drug issues, and it brings together all the data wonks on a topic. And Minnesota's SEOW, even though SAMHSA doesn't require it anymore, it's been continued in Minnesota by the Department of Human Services, deals with drug issues. We said, hey, this is something that works. And recently, as we've gotten some state funding around for suicide prevention, we've created a suicide state epi outcomes work group. And after today, I'm saying we need an SEOW, a sexual violence state epi outcomes work group, where we get all the data wonks together who have sexual violence data, where we sit down once or twice a year and talk shop, look at our different data and say, okay, so what are you seeing? How could we look at our data differently? If a survey's coming online, how should we ask the questions? How should we change it, et cetera? So I'm thinking, and that I think would be a real good role for the state health department. And so Amy, I'm going to be talking with you about the getting an SEOW going for Minnesota.
And I am looking around the room, and I know there are several people that will be calling and saying, I want to be part of that. So, so thank you. If I say anything else, John, I'm going to have to bring you up front. So usually during these last few minutes of the meeting, we ask people if they have any announcements or anything they want to share, any resources. Once again, I'm going to put somebody on the spot. Deb, I'm sorry to do this, because you mentioned your class, and I think it's really important to, John, could you pass your mic over to Deb? I think this is a great opportunity to share it, and I'll also send it out on the list too. So.
Sure. So I'm Deb Fitzpatrick. I direct the Center on Women, Gender, and Public Policy at the Humphrey School, and I co-teach a class in the spring with Lauren Martin, who's the Director of Research and Outreach at the University Research and Outreach Center in North Minneapolis. And it's on doing policy and research in marginalized communities, and we do sex trading and sex trafficking as a case study to think about how we're doing that kind of work, both the research methods and community-based participatory research methods, but then how are we bringing that into the policy arena? So we're excited to teach that in the spring. It's at the Humphrey School. We usually have students from all different departments that participate in that. We have great people like Amy come in and speak, but so just check it out if you're interested, or let me know if you have questions. Thanks.
Great, thank you. And either you or Lauren will maybe send me that class flyer and get it out to folks. Maybe Pahua will too. And an announcement back here. And I know Melissa wants to share something as well. So we'll get to Melissa, but how about you first?
Well, my name is Jennifer James. I'm actually representing Project Pathfinder, which is a treatment facility for sex offenders with problematic behaviors. But under that umbrella, we're expanding the Pathfinder counseling services. Currently, we're doing sexology, psych ed courses under the Title IX with various colleges and universities. Sorry. I'm also getting over kind of like a little cold and also with the baby. And then part of that, we're rolling out in 2018 more prevention programming, counseling, therapy, domestic violence programming, also John School. So there's a lot that we're going to be doing in 2018 that we're going to be marketing, and just noticing and realizing that there's two scopes to preventing sexual violence, and we're going to try to work towards that and move towards our mission and our vision of ending sexual violence. So and Diane Neal is the person that's overseeing that, and I'm her assistant, so just representing her.
Okay, thank you. Anybody else? Anything you want to share or any announcements? Okay, Melissa, did you want to add what you, yeah.
Yeah, kind of jumping off of what Valerie was talking about the Minnesota student survey questions, the MSS questions. And John, thank you for saying data wonks, because I'm going to use your terminology. So we're actually, Marissa, my partner in crime, and I are actually going through a process right now to find out from community stakeholders, people kind of who do sexual violence, domestic intimate partner violence work, specifically on those questions and a couple more, the Minnesota student survey questions. And we're going through a process. So we are doing community listening sessions, youth listening sessions, a roundtable around kind of rewording suggestions. So we're trying to potentially update, make more relevant some of these questions. So if anyone's really interested, data wonks in the room, feel free to come up to Marissa or I and chat with us, and we can see if there's opportunity or kind of figure out how we can work with you and kind of get your ideas. So, thanks.
Thank you. Okay, anything else? Thank you so much, Valerie, for your presentation, and also to all of you for your input on our wall art back there that I think you'll be pulling together, and then we'll send it out to folks. Great. Okay. Thank you all. And oh, you know what I wanted to say? Sorry, I do have an announcement. So we are, this is the end of our 19th year of SVPN meetings, and it just blows me away that this has been going on for, well, next year it'll be 20 years. So next year we will be having a celebration of our 20th year. So we don't know what we're doing yet. We'll let you know, but watch for an announcement on that, and we'll think of something fun. But I think largely what we need to do is celebrate the good work that we've done. We've come a long way in the last, I haven't been with SVPN for 20 years, but I have been for almost 20 years, not quite 20. But anyway, so watch for that announcement, and I think that's all I had. So thank you, and have a great day, and we'll see you next time.